Well, I'd like to say hello to all the volunteers who are on the line tonight and listening to this later. We're going to talk about public health outreach education for MRC volunteers. And I am Lori Andrews Spear. I'm the Northern Region Public Information Officer, and in that role I do communicate for 8 health districts here in the Northern Region, and there are 4 of us throughout the state that do the same thing in each of the regions. We're going to cover the value of community outreach, prevention and preparedness, emergency response, public health communications, and strategies for communicating in an emergency. So we hope this class is going to prepare you. Sorry, I heard something in the background. So we hope this class is going to prepare you to share and promote public health messages at community outreach events. Many of you have already done this, and I hope this isn't repetitive, but this may be a little bit of a review, but hopefully you're going to gain something new to use the next time you work an event, or in the case of an emergency, if you're working at a shelter or another place. So you've chosen an exciting time to be part of the Virginia Department of Health. We are striving to make Virginia the healthiest state, and we want to talk about these different things and the different areas that Virginians can be healthier. Longer lives, reduced health care costs, better quality of life, stronger communities, less disease, and a strong workforce. VDH is also working collaborative with public and private partners to develop a population health plan, which we're actually calling a plan for well-being for all of Virginia. And so the plan is going to provide an organizational framework to work towards improving the health of all Virginians. If you want more information about this, just go to our website at vdh.virginia.gov, and there's more information about it on that website. So this is a map of Virginia, and these are our health districts and our health regions. We, as an MRC, you support ongoing public health initiatives and emergencies in localities throughout Virginia. So these are all of our health districts, and we're split into different regions, and I'm sure everyone can locate their own unit on this map. And you as MRC volunteers play an important role in the health department. You guys are the boots on the ground in each district. It includes general community wellness as well as helping your communities in an emergency. So I wanted to go over a little bit about VDH offices and program areas. And this is not an inclusive list, but it'll give you an idea of some of the many programs that we have with VDH. Epidemiology, immunizations, all kinds of things. Right now we're getting ready to back to school immunizations throughout the summer. We also do adult immunizations, family health services, and disease prevention. That's a very important role that we play. We have a minority health office, of course, emergency preparedness and response, which is a lot of what MRC helps with. Also environmental health. They do restaurant inspections and also take care of our water. Radiological health, food and water, of course, we take care of that. Risk communication and education, and that's actually my office. I do risk communication and education throughout the state and in my region here. We have the Office of the Chief Medical Examiner, which determines the cause and manner of death in certain deaths in the state. And of course, emergency medical services, or EMS. Here are some of the focus areas we have for preventing disease and promoting health. And you can see these on here: cancer, heart disease, diabetes, and stroke. Those are a lot of the big things that are health problems for a lot of people. We also do some of the prevention and health promotion initiatives we have, things like healthy eating, active living, obesity prevention, tobacco use. That's a big one that we try to discourage use of tobacco. Injury prevention, things like where you're having your child seat fitted correctly in your car. We want those to be fitted correctly so we don't have fewer injuries of children. Youth violence, things like bullying, domestic and sexual violence is a big initiative, and suicide, of course. So you may know some of the programs in your own districts. Some of the examples, we have a huge program on Lyme disease in one of my districts up here. Some of the more urban areas may have programs for community gardens for their WIC participants, or they're educating city dwellers on things like food deserts, where you're not able to get fresh food because you live in an area that doesn't have a nice grocery store and you can't get to an area where you can get fresh fruits and vegetables, which are healthier for you.
Put the dog outside, please.
We also have the Million Hearts Initiative, which is reaching out to faith communities to spread information on heart-healthy living in that community. So just think about a little bit about some of the initiatives in your district and how you might be able to help with those. And here's some other examples through pictures, things like the Coca-Cola bottles here with the sugar, talking about how much sugar is in sweetened beverages.
Oh, yeah.
Prescription drugs and our senior population. Things like Fight Back, which is keeping food safe from bacteria. That's coming up in the summer. It's going to be very important. Things like keeping your salads refrigerated at picnics and that kind of thing. Ready.gov, the Prepare, Plan, Stay Informed. That's about emergency preparedness, and this little girl, of course, needs her flu shot because she's sick. The MRC involvement, here's a couple of photos of an MRC activity that I went to. Mass dispensing exercises in case of a point of dispensing for some kind of disaster where we need to get drugs out to everyone. Emergency shelters, things like cooling shelters in the summer, or if there's a flood and people are flooded out of their houses, MRC might be called in to help with emergency shelters. Medical surge, and also disease investigations. Here in the Northern District, you may have heard last year about our measles cases where some MRC were activated to help in a phone bank. So that was kind of an interesting activity. And of course, emergency events. Here are some of the emergency events that Virginia Department of Health has had to deal with. Things like weather. We're actually just starting into hurricane season now, so hurricane preparedness is very important throughout the year, but especially in the summer. Power outages, we want people to be prepared in case their power goes out. Things like the mass casualty shootings at Virginia Tech. Those are some emergency events that we've had to deal with. Communicable diseases. Right now in Dulles Airport, as you know, we're screening people for Ebola who are coming from those 3 countries in Africa, and they have to be followed for 21 days to make sure they don't get sick. So that's a big initiative here. H1N1 in the past was a big initiative. Things like meningitis or MRSA or Legionella, foodborne diseases, anything in the air or waterborne diseases could also be classified as emergency events. We've had boil water notices because of things in the water, things like recreational water. We have beach closures. That's another thing that BDH does, and many, many, many things more. And we do partner with many different agencies and organizations. Here are just a few of them. The hospitals, we have hospital groups that we deal with and coordinate with so that we're all prepared in the case of an emergency. Of course, the Red Cross is a great partner of ours that provides things in an emergency. Sometimes they call in the National Guard, and then here are some health department folks at an event. So here are the 4 phases of emergency management. You may have seen this before or at least heard about it. We start out with, well, it's a circle, so we can start anywhere. But what we try to start with preparedness and prevention and mitigation. We want to prevent disasters. We want to be prepared for them if they do happen. Then we want to respond, and then we want to recover. And MRC volunteers can help with many of these. Things like prevention and mitigation would include health fairs, flu shot clinics, things like that. Preparedness includes exercises, getting emergency preparedness, get a kit, make a plan, stay informed, and then help other people do that as well. Things in response would include shelters, things like the H1N1 flu shot clinics were responding to that new flu strain. And we helped out a lot with that, and MRC members were a big part of that. After emergencies, recovery is also important, things like handing out water after a hurricane. And so here's a nice way that these things build upon each other. Prevention, mitigation, things like staying healthy. We want to stay healthy so that we can prevent disease, and you want to be prepared so you can prevent disasters having such an effect on you. Preparedness, again, getting a kit, making a plan, and stay informed. And participating in exercises is a great way to help with preparedness. response, know where to go and what to do. You have better experience at the shelters if you've already prepared and if you're healthy, so it's kind of building on it, those. And then recovery, if you've prevented disease or prepared for a disaster and you know where to go and what to do because you've done those things, the recovery is faster and better, and you get back to your normal or new normal a lot more quickly and more effectively. And that's called resilience. This is a new key term that has been thrown around a lot, but it's very important to talk about resistance. It's the capacity to recover quickly from difficulties. It's being tough. You can bounce back after setbacks if you're resilient. And then if the people in your community are resilient, it makes community resilient. So it's the capacity of communities to respond positively to crises. And that's where the MRC comes in, because you guys are out there helping people be prepared. And even by being prepared yourself, you're setting a great example for your friends and neighbors and your family about being prepared. And the more people that are prepared, the better your community can respond to disasters and bounce back from them. And this is another example of how that works. So the little ball thing at the bottom here, if you're ready, you know, you're a whole circle. And then if you have an effect like a disaster or an emergency, you can bend, not break. You can bend to it and respond better and experience less of an effect. And then it transitions, and then you recover faster and return to normalcy better. And you can recover more fully. And this has been proven again and again. Things like when people are evacuated from nursing homes and floods. I was listening to a talk the other day on a nursing home that had gotten flooded, and they had to move all of the people out. And they were prepared because it was a good nursing home that had a great plan for emergency evacuations. They had places they were going to put the people. They had paper copies of the records so that they were ready for that to happen, and they had the emergency contact people, the families of all of the folks in their nursing home who they could contact more quickly. So they were able to get half of their people with their family members in the first day, which was great because that meant that only half of the people had to be sheltered in a place that was unfamiliar to them. So, you know, that's uncomfortable for most of us, but especially folks who are in a nursing home who may have medical difficulties. It's very bad for them to be thrown into an unfamiliar place. So it's much better if they can get with their family members more quickly, and that is a better outcome. So we're going to talk about some communication strategies, the public health communications, as well as communicating in an emergency. And you may think, well, communicating is communicating, but it's a lot different just trying to convince people to make a change in behavior that's something every day, you know, oh, it's good for you. And then there's also the difference, it's a lot different in an emergency when their life may depend on it. So I won't ask you to close your eyes, but if you could just think for a moment, who talks to you? Recall a time when someone effectively or ineffectively engaged you in trying to market something. So I'm going to give you a second to think about that. And I really want you to visualize it, and you think about what they said, the words they used. How was their voice? Was it high-pitched, low-pitched? Did they talk fast? Did they talk slow? What did they look like, the person that was talking to you if you were in person? Did you notice what they were wearing? Were they close to you? Were they far away from you? Were they on the telephone? Could you tell what they were feeling if they were on the telephone? Were they pleasant? Were they pushy? That kind of thing. So what kind of impression did they make on you? And did you buy what they were selling in the end? So here are some examples that I've gotten from people in the past. Telemarketers. We all tend to think about our negative kind of experiences more often than our positive ones. So telemarketers, I kind of feel like this woman. I was actually reviewing this speech the other night, and a telemarketer called from a home improvement store trying to sell me something to do in my home, and it was very pushy. So that wasn't a very pleasant experience for me. Home improvement, like I said, salespeople. Perfume spritzers. Have you ever been walking through the stores at the mall and you see the woman or the man with the little spritz of perfume that wants to spray it on you and make you smell it so that you'll buy it? Things like survey takers. If you're walking, again, through a food court at the mall or something and you see someone with a clipboard, do you walk the other way? Or if you see someone walking in your neighborhood with clipboards, do you shut the door and not answer it? And then what about your family or your spouse or your children? Have they marketed to you? And were they effective? What strategies did they use? And then maybe a positive, just to end on a positive note, I know I can't resist the Girl Scouts in front of the grocery store trying to sell you cookies. So that's another way that you can think of someone who's trying to market something to you. But we're talking about public health, so I wanted to go over a little bit about what is public health. It's the science and art of preventing disease, prolonging life, and promoting health. If you think about it, that kind of encompasses a lot of what we're trying to do. But it involves the organized efforts and informed choices of societies, organizations, public and private, communities, and individuals. So I underlined a few words that we're going to try to focus on, the informed choices of individuals. Because a lot of what you and I are going to do when we go out and volunteer with MRCs is talk to people one-on-one. And we want that to be a positive experience, and we want everyone to be able to communicate effectively with those folks and have them change their behavior or take the direction that we're offering or do what we think is going to affect their health in a positive direction. And this is an interesting inverted pyramid that I found that talks about how in the information age, healthcare is a lot different than it used to be. It used to be that professionals were authorities, and if a doctor told you to do something, you did it. Then they were partners, so you kind of, maybe you negotiated with them about what to do for your health. And then they were facilitators. They kind of helped you along, but you could kind of do your own thing too. Then we went into self-help networks, friends and family, and individual self-care. So I can't see all of you, but raise your hand if you've ever looked up your symptoms on WebMD or another site on the online universe. I know I have. But if you look up things on that, you are involved in individual self-care. And that has to do with this little arrow on the left where there's a dollar sign at the bottom where the professionals are the authorities, and then there's a cents sign at the top where you and I can go on the internet and look up our symptoms and figure out what we have, and it costs us nothing. So that's one of the ways things have changed. And of course, social networking is another thing, the whole self-care and friends and family and self-help networks with the advent of social media, things like Facebook. There's a support group for every real and imagined condition or disease out there. And for the most part, it's just people getting together and supporting each other, which is a great thing. But then sometimes you may have things like marketing emails or marketing mail that you get at home. I know my dad is elderly, and he gets tons of mail from different places promising to cure everything from cancer to, dry skin with some miracle drug that, for just $29.99, send your check to this address. So we want to really be careful with that, and this is kind of what you and I are fighting when we try to go out and talk to people at health fairs. And that's another reason that we have problems is that people do resist change. And the reasons they resist change are things like their beliefs, their values. Sometimes cultures have different viewpoints about their health than other cultures, and they may not believe in things that have been just discovered, or some countries there's distrust of doctors or the government who are trying to give you inoculations because bad things have happened in the past. So that's one of the reasons people don't want to trust that. Again, experience, if they've had a bad experience. I know I fight this all the time when people say, I got the flu shot and it gave me the flu. So people get sick right after they get the flu shot. It could have nothing to do with the flu shot, but they believe that it does, and so they don't want to have the flu shot because they think it's going to give them the flu. And that's, again, anecdotal evidence. My brother said he got the flu after he got the flu shot, so we have to overcome those. And distrust of authority, again, some people don't believe in doctors and what they're doing. And then comfort zone. Nobody wants to get out of their comfort zone. Just an inertia, an unwillingness to change because I'm pretty comfortable the way I am. So how can we get people to change their behavior? Here's some ideas, and this is based on the health belief model, which is very interesting. It was developed in the 1950s to get a better understanding of why some people were getting the tuberculosis test and others weren't. So they were trying to boost the tuberculosis testing, and they tried to see what they could do to do that. And so this is what they came up with. Things like considering the risks of your current behavior, analyze how serious those risks are, recognize the benefits and motivators to change the behavior, overcome the barriers that you have to changing your behavior, and using things like you can do it and here's how. So, encouraging people that they have the capability to do it, and I'm going to help you learn how to do it, but you're going to be doing it. So people just have to believe in themselves to make the change. So in order to better understand this, I thought we could apply this model to a scenario. So first, one of the first rules of communication is to consider your audience. So who are you going to be talking to? What's their age, what's their gender, and that may determine how you're going to talk to them and the things you're going to use to convince them of your viewpoint. So then you need to address your risks of your current behavior. For example, let's talk about preparedness, the ready.gov, get a kit, make a plan, stay informed. This applies to all audience groups because everyone needs to be prepared. Some of the risks of not being prepared. If your current behavior is you're not prepared. If you're not prepared and the power goes out, and you don't have a kit, you're going to run out of water, you're going to run out of food. I guess in a serious situation you might starve, but otherwise you're going to be very uncomfortable. So the seriousness of the risk, like I said, if it only lasts a few days, you may, and you don't have a lot of good food, you may end up eating the can of tuna out of your cabinet that you don't really like. So that's not a real serious risk. But what about, let's think about, what if you don't have your blood pressure medicine? What if you are dependent on a piece of medical equipment that requires power and you don't have a backup battery? Things like that can really be serious. The benefits and motivation. So if you are prepared, you're a good citizen, you're a good neighbor, you're a good family member, you're a good provider for your family, you help survive the situation that's coming up, and maybe you help your neighbors, which is great. And for example, if you have to evacuate to a shelter and you have your kit all together, you're going to be more comfortable and you're going to have foods that you like, and you might not like the things that the shelter is able to give you. Things of barriers that you might run into, or people might say that they run into for being prepared. The cost of getting a kit. People say, I don't have enough money to get those items in the kit. So some of the ways to overcome those barriers, there's different ways you can buy a few items at a time. Recently we had a sales tax holiday. If people take advantage of that, sometimes that helps out with the cost. And then effective strategies. The ready.gov has a new app for your cell phone, so both of the kinds of cell phones. But there's a ready.gov app that can give you a step-by-step way to make a plan. You can input your emergency telephone numbers, your meeting place for your whole family if you all get separated, that kind of thing. So that's an effective strategy for getting your kit together and being prepared. So communications is multidimensional. The content is going to be provided for you from your brochures or your display at your outreach event, or if it's in the case of an emergency, you'll be given the checklist that you have to use or the form that you have to help people fill out, or your job at the event. It's messenger, and that's you. So we're going to talk a little bit later on about how to represent the MRC and BDH professionally, and we're just going to review some of the basics that I'm sure you've all heard before, but we'll just review them. And then your method of delivery, and that's what most of what the rest of this presentation is going to be talking about. And it's good as a reminder, and it may seem like a review for a lot of you, but it's good for us all to review it every so often so that it's kind of second nature when we get out there that we have great communications tools at our disposal. So communicating has many elements. Frequency, how often you hear something. A lot of times they say you don't remember something until you hear it 3 or 4 times. Talking is not communicating. So I can talk to you, but you may not be hearing me. And that's, again, hearing and listening are 2 different things. So you may hear me, but you may not be listening to me and understanding me. And so we need to have interactive listening, and we'll talk some more about how we do that. And then engaging for action. So we definitely want to have people engaged. So again, you don't have to close your eyes, but I wanted you to visualize the last time you noticed someone not paying attention to you. Maybe it was a teenager, maybe it was a coworker or an employee, or someone when you were out shopping, something like that. How did that make you feel? Were you frustrated, maybe angry, or maybe you thought that person was wasting your time? So we don't want our clients to feel that way when we're talking to them, so we're going to give you some good ways that we can get through that. And here's just a little cartoon about listening. You weren't listening, I said, don't fall. So again, sometimes we do have to get through to people, and so they understand what we're talking about. And one of the ways to do that is becoming an active listener. So if you look at the speaker and have good eye contact, it increases your chance of getting the message and for them to get it correct when they hear it from you. Just one little caveat, be aware of different cultural norms. Some cultures don't like people staring them right in the eyes, and if people seem uncomfortable when you're using eye contact, maybe back off a little bit. Turn your body towards the speaker so that they know that you're paying attention to them. Nod or give verbal encouragement to share. You can say, and you need to concentrate on it. A lot of times they say people are always thinking about what they're going to say next while the other person's talking, and we all really need to take some time and just concentrate on what the other person is saying before we think about what we're going to say in return. And then ask clarifying questions. Things like, so I hear you saying that, you know, the last time you had a measles shot was this date. Things like that. You definitely want them to know that you're listening to them, that you heard them, and that gives you an opportunity, if you didn't hear them exactly right, to clarify what they meant. And then listening on the phone. As I mentioned earlier, some parts of MRC volunteering may be staffing a call center. So here's some hints for phone listening in addition to the ones that we just talked about. Sometimes it helps to focus on a blank wall or a blank sheet of paper on your desk so that you're not preoccupied by other things going on. Okay, someone's sharing their screen. They need to unshare that. I'm not sure how that worked, but I don't see it anymore. Okay, I'm going to try again to share my screen. Okay, there we go. So I was on slide number 27. Hold on one second. And there we go. Okay, so we were talking about listening on the phone. Okay, so focusing on a blank wall or a blank sheet of paper will help you not be distracted by things in your office or things going on around you. And I know that may be difficult if you're in a phone bank with a room full of people like a telephone, but that's why maybe a blank sheet of paper or something, or a blank spot on your notepad. Position yourself so you're comfortable but not completely relaxed. So you need to be upright, you need to be attentive to the person on the phone, and make sure your volume is good for the caller. I know my parents both have hearing problems, so I have to make sure that they can hear me when I call them, especially on my cell phone, because sometimes cell phones are even harder to hear from, or for them to hear on, than regular phones. And then some things to avoid. We don't want to be this woman on the left. We don't want to be shaking our finger in people's faces. We don't want to criticize people for their current behaviors. We want to just encourage them and be positive. We don't want to second guess. We don't want to make assumptions about people, discount their worries. A lot of times things may seem irrational to us, but that's just from our viewpoint. So we try to put ourselves in the other person's place and think about the way that they're feeling. But we don't want to placate them. We don't want to be condescending or generalize the way that their issue that they're talking about. You don't want to let your feelings interfere with your ability to communicate positively. And that's kind of hard, because sometimes you just want to say, oh my gosh, I can't believe you think that, or that you did that. But you really need to stay positive and keep your feelings to yourself. And again, the last one, we don't want to look like this lady. We don't want to convey disgust or frustration or even indifference or fear. If someone starts talking about something, you want to make them feel comfortable. And these are gold right here. These things here are very gold. They're good for you to use if you're having someone who is giving you feedback. It helps you stay positive and stay a good representative. So you can say, I hear your point. It doesn't mean you agree with the person. It just means you hear them. And that's true. And you don't have to say you agree or you disagree. You say, I hear you. And then I know some MRCs are medical professionals, but as an MRC volunteer, you don't really want to respond to individual medical questions. You want to refer people to their personal physician or a clinic, like the health clinics. And it's okay to say, I don't know. That's a great question. Let me find someone that can answer that for you, or let me give you the number and you can call the health department on Monday and they can tell you more about this. And I'm sure my MRC coordinator can get me a contact number for someone at the health department that you can talk to. And you want to turn negatives into positives. And I know sometimes that's hard to focus on the positive instead of the negative. You know, don't smoke, don't smoke. But, you know, instead of smoking, you can go out and take a walk or, you know, do something else that's more positive. And then bridging back to your messages. The messages that you're going to be presenting are going to be the things that, you know, are on the display board at the outreach, or, you know, things at a shelter that you're supposed to be talking about. But you need to learn to bridge back to those. And these, I use these bridging phrases when I teach media training to our health directors and other health staff. And it's a good way to get back to your point subtly. So if someone goes off on a tangent, you can lead them back to your point by saying, well, what's most important is that we, you know, stay safe here in the shelter. You know, I'm sorry that we don't have, you know, 64 channels of television for you to watch, but what's most important is that we're safe and we're out of the storm, that kind of thing. What we should focus on is, so you can take the focus away from whatever you're getting off on a tangent on and say, well, really what we should focus on is whatever. What the public should know, that speaks to a larger point. So that's, you know, when someone gets down into the weeds or into the details, you know, that speaks to a larger point of overall health, that kind of thing. And then I don't know that answer, but what I can tell you is, so if someone tries to get you to go too deeply into diagnosing a disease or something like that, you can say, well, I don't know that answer, but what I can tell you is, for example, you know, we're giving the flu shot today, and it covers, you know, several strains of the flu, and, you know, everyone should get a flu shot. So those are some bridging phrases, and they're good to remember. So then communicating in an emergency event is different for a lot of reasons. These are some of the things you may be experiencing. Flu clinics, like the H1N1 clinics. I know many of you probably helped out with those a few years ago. Points of dispensing, that's when we give out things like Cipro, if there were to be a biological agent dispersal. environmental hazards, something like a disease outbreak or a weather situation. And then a lot of times we go to drills and exercises, which are pretend emergency events, but it's really good to go to those. And then other things. But in a serious crisis, affected people take in their information differently, and they also process it differently, and they act on it differently than they would when it was a non-emergency situation. And it has to do with stress. They say people remember like 1/3 of the amount of data or information when it's an emergency event versus if they're calm and there's not something like an emergency going on. So here are some of the emergency events that we can talk about. These are snowstorms, floods. This looks like a tornado or some kind of other weather event that happened here. And of course, there's a mosquito there for West Nile. And here's some man-made emergency events, which a lot of times these are even more scary for people because they're not just an act of nature, they're an act of man. And so you don't really know if it's going to happen again, like train wrecks or this is a mailman because, you know, we had those anthrax activities a couple years ago. So, and of course, the man-made ones are intentional. And then some obstacles that we also face in emergency. These are kind of similar to the ones we focus on for non-emergency events, things like uncertainty about the future, the complexity of diseases. There's a study out there for everything, and people hear these studies on the news and they say, oh, this study showed such and such, you know, is it true? It's just so complex to go through all of the medical information and find out what's going on. And that inspires distrust too. And then you have conflicting evidence. There's studies on one side of thing that prove one thing, there's studies on another side that prove another, there's morning television shows that talk about different evidence of different cures for different conditions, and then selective reporting by the news media. The news media likes to sensationalize things, so a lot of times you just hear the most sensational thing. If one person has an adverse reaction to something, that's the story on the news media. And it may not even have been due to that, you know, condition, but that's what you're going to hear on the news because it is sensationalized. And then in an emergency, when you're stressed, emotion may trump your logic. So you may have an irrational fear of something and not be thinking rationally or logically. Personal information, this has to do with things like not sharing personal details during, if you're volunteering at a shelter. We don't want to violate the HIPAA rules about patient confidentiality, so we want to be real careful about personal information. Language and culture, this is another one. Language, of course, if you don't speak the same language, how are you going to understand each other? That's very hard, especially in an emergency situation. And different cultures may react differently to you and your information that you're trying to give them, as we talked about before. And then your physical presence. This is very important for children especially. You want to get down on their level and talk to them one-on-one. If someone's in a wheelchair, don't tower over them, things like that. And then here's, empathy is a really good word for what we want to try to show when we're out there talking to people, especially in an emergency situation, but even in a non-emergency situation. You want to empathize with their fear, confusion, and frustration, because really we've all been there. You know, there's something that scares every one of us, and just think about that when you see someone who's afraid of a situation. And you may know that it's going to be okay, but you can't discount their fear, confusion, or frustration. You want to empower them to make their informed decisions. So you want to give them the information so that they can come to a decision. A lot of times you can just tell them what the right thing to do is, but unless you justify that and tell them how you got to that decision, they're not going to come to the same decision as you did. And then discourage negative behavior and encourage constructive actions. A lot of times people want something to do so they feel like they're helping out. A lot of times, I know before a big snowstorm, everyone goes to the supermarket and buys bread and toilet paper and milk, and they all do that because they want to feel like they have some control and they're doing something constructive to help deal with that situation. So just think about that when you're trying to come up with things for people to do that are positive and constructive in an emergency situation. So delivering the message. Just wanted to go over a few things. Emergency communications do have special requirements because of the heightened stress of the situation, and we have to be extra clear. We can't yell at people in the ear with a bullhorn, but we do have to be extra clear so that they do understand. And here's some things that I wanted to talk about. We need to keep it simple, but we don't want to over-reassure. You don't want to say, oh, everything's going to be okay, because really, if it is a disaster and someone's home has been destroyed by a tornado or a hurricane has caused flooding or trees to fall on people's houses, it may not be okay. But there are ways to assure people that we'll get through it. Relate and repeat general facts about the incident or event. If you know a few things, say those facts about the incident or event. Don't over-reassure, but limit the information to what's been released. So if you overhear something that has not been shared with everyone, don't start sharing that with everyone. I know that's kind of common sense, but just think about that. We don't want to start a panic or get information out that's not been vetted. And we can admit, well, we don't know at present. Well, we really don't know how long it's going to take to recover from the storm or how long it's going to take for the water to recede out of this photo right here. But we are taking some actions, and here's what you can do. You can get sandbags, put those up at your doorstep or something like that. You know, of course, that's going to vary by the disaster, but there are things that you can do to help the situation. So changing health behavior is a challenge, and I think we've seen many reasons and many ways that people don't want to get out of their comfort zone. They want to stay in their comfort zone, but we do need to recognize their frustrations and communicate with empathy and compassion. When it comes right down to it, we're here to help, so we really want to be helpful to people. We want to actively listen to them so that they know that we care about them and that we really do want to hear what they're saying and help them. And then answer their questions thoughtfully. Think about what you need to say. And if you don't know the answer, feel free to refer to resources or somebody else who may know that answer. And your MRC coordinator is a great resource for that. They do have lots of knowledge about the Virginia Department of Health and other people in your health district who may be able to help people. And the VDH does provide lots of services for people, and we refer people to other services when we're not able to help them. So it's a great service that we provide, and you guys are out there talking to people on a daily basis or whenever you're able to volunteer. So we do want you to be able to refer people to us so that we can help them if you don't know where to refer them. And resilience, again, this is the resilience, this is the little happy person bouncing back. If you're healthier and more prepared, you can respond better in emergency and recover faster and better. So if you're healthier, you're not going to be susceptible to diseases as much, so you're going to be able to resist them, and then even if you do get them, you can recover faster and better. Same thing in an emergency situation. If you're prepared, it may destroy some of your possessions, but you may survive, which is great. If you have more resilient individuals, they together make a more resilient community. And you all can help, because if no one in the community is resilient, more than you guys are resilient, because I know you're all prepared because you're MRC members. And then I just wanted to go over a few Medical Reserve Corps outreach reminders, things like before an event, you should attend any required training, and I appreciate everyone coming to this training and learning about outreach. and communication. And then review your talking points if you're given talking points, and ask questions for clarification from your MRC coordinator or your trainer who's training you for the event that you're going to be doing. And think about the simple messages. Sorry, there's a T missing there. Think about the simple messages that you can convey. And then arrange pickup of materials if you have materials that you're supposed to take to the event that you're doing. So at an event, I know many of the different MRC units have their own dress code. They might have a shirt that they all wear, or they all wear khaki pants or blue pants. So your MRC coordinator can provide that information to you. Whatever you wear, you should look clean and professional, and I know you're all going to do that. And have your point of contact information for your MRC staff person available to you. So if you come across some sort of question that you don't understand or aren't able to answer, or a problem, you'll be able to get in touch with that staff person. And then a lot of times it's very important to sign in and sign out of an event, especially if it's an emergency event like a shelter, and you definitely want to list your emergency contact information as required. For example, I was talking to someone who was looking for 2 of the people that were volunteering, and they had just left, and then there was like a weather event, like a thunderstorm at the event, and they were trying to find those 2 people, and they had already left, but they didn't sign out with the person at their volunteer event, so they were calling all over trying to find them, and it turns out they had left an hour ago. So we really don't want people to get lost in the fray if we were to have some sort of an emergency event at, let's say, an outdoor fair or something like that. And just remember, you're a representative of the Virginia Department of Health and the Medical Reserve Corps and your unit, your health district, when you're out there talking to other folks. And then again, recruit. You guys are the best folks to get other folks to join you to help out with the Medical Reserve Corps. And the Medical Reserve Corps does look for people with all kinds of skills, medical and non-medical. You just have to be 18 years and older. And then during emergencies, that means that you're pre-registered and trained to respond, and then you participate in things like community events and outreach, and that's kind of what we were talking about today, things like clinics, flu shot clinics during flu season, that kind of thing, training drills and exercises. And I wanted to especially give a shout out about exercises, because I was at an exercise just the other day, and I saw MRC members from several different units who were supporting this other unit who was doing a very important exercise to test a new point of dispensing method. So it was really good to see the people in their different MRC shirts from different units coming out to support a unit. And then your time commitment can vary based on how much you want to do and how little you want to do, if you wanted to do emergency events or if you just wanted to do community fairs. So you can talk to your MRC coordinator about that. And I wanted to, again, encourage you to go to the website, vdh.virginia.gov, look at the program areas that the Virginia Department of Health covers, and click on the different local health district sites and see what other health districts are doing, because that's kind of interesting to see different parts of the state have different initiatives. So, but mainly I just wanted to thank you all for everything that you do, and that was the presentation that I had for you all tonight, and I hope that you learned something about communicating both just public health messages on an everyday basis at events, as well as sharing important information with people during an emergency.
Okay, so thank you very much, Lori. We appreciate your time and your effort in developing this training for us tonight, and yes, I hope you all learned something. If you have any questions, please put them in the chat box, and I will pass them on to the presenter. So let's take about 10 minutes for some questions now. Someone asked about the recording of this webinar tonight. I am in the process of recording that. We send the recording to our instructional designer, who will convert that recording to YouTube. Barring any technical difficulties doing that, we would post that up on YouTube. You would get a link to that via your MRC unit coordinator.
So Teresa, did you find any other questions in the chat box, or
I do not see any. I'm continuing to scroll to look. I see no questions. I have some positive comments coming in. Okay. So hearing no other questions, I'm going to go ahead and stop the recording.